You use a multidisciplinary approach to treating brain cancer. Why don't you tell us about that?
Most brain tumors are not initially seen by a neurosurgeon. They are initially diagnosed and treated by medical doctors. But when they come to see us, we have the advantage that, first off, we have great technology to image any tumor in the brain. We have dedicated neuroradiologists, not just radiologists, neuroradiologists who can interpret these images. We have a world-class oncology service who also deals with specific tumors of the brain. Through my association with Penn State Hershey, we also have a full-time neuro-oncologist that I can call on in case we have to treat tumors of the brain with either chemotherapy or any other associated modality. If we have to do surgery, we have the advantage of having a radiation oncologist who is well trained in treating tumors of the brain with radiation. So not only can we diagnose these tumors very accurately, we have the medical and radiation expertise to treat all aspects of the disease.
Tell us about some of the technology involved in diagnosing brain tumors.
At our institution, we have high-field MRIs, which are probably the most accurate for determining where a tumor is and how large it is. We also have the capacity, once we decide that we have to treat this tumor, to biopsy it without undergoing major brain surgery. This is a procedure called stereotactic biopsy. Instead of physically opening the entire skull to try to take a piece of the tumor, we can take a small piece with a needle, but the way we insert this needle is we have in our operating room special equipment that is hooked up to a computer where we can precisely localize any area of the brain, put a needle into that area within 1 or 2 millimeters of tolerance, and get a small piece of tumor. In that way, we can figure out what this tumor is and whether it even needs to go to surgery in the first place. Even before we go to surgery, we can plan our operation. If we see that there is a tumor in the brain that is very close to a spot that is dangerous, we can plot all the dangerous areas and be sure to exclude them when we approach the tumor.
Dr. De Luna, Wilkes-Barre General Hospital has one of only a handful of intraoperative MRI units for use during brain surgery. Why don't you tell us about that?
An intraoperative MRI is a device that we can bring into surgery, and it will allow us to look at the brain while we perform surgery. By bringing in an MRI during your surgery, you can perform spot checks. That decision-making process could only be possible if you were doing the imaging while the surgery was taking place. Without that, you don't know. You can only judge by what you feel and what you see. So an intraoperative MRI makes a good surgeon even better. For a patient, it makes their surgery even safer because it allows very precise, very exact removal of abnormal tissue in the brain.
Doctor, what are the options for patients who can't have their cancer treated surgically?
It is one of the unfortunate side effects of all medicine that there are some tumors that are completely inoperable, whether by location or by size. There is an option, however, for smaller tumors, even if they are inaccessible. This is made possible by a technology that we have here at Wyoming Valley called the Gamma Knife. What the Gamma Knife is a radiation device, but instead of applying radiation to an entire region of the brain, it uses very small, pencil-thin beams of radiation. Each individual beam by itself is harmless, but we use a computer to direct each individual beam to a central target in the brain. The computer we use can focus these beams to within 1 or 2 millimeters of tolerance, so we can go into areas of the brain which are inaccessible by any other method. And as long as the tumor is small enough, we can treat it and essentially burn the tumor away. More precisely, what the focused radiation does is it turns off the DNA of the tumor. This doesn't destroy the tumor, the mass is still there, but it prevents it from growing. And this is one of the few options available where we can treat tumors that are otherwise completely inaccessible.